Hi, I'm Candace, and I've chosen to demonstrate blood pressure for you. Nursing is an amazing and very rewarding profession. It is very difficult, but once you learn it, it'll become like second nature. One important technique of nursing is taking blood pressure. It is important to know how to take blood pressure because if it is ever too high or too low, then that could be a serious medical emergency. Knowing how to take blood pressure is very crucial. If you don't know how to take blood pressure, you can damage the patient. You have to properly pump the blood pressure up to 180 and be able to slowly release it and listen for the pulse to begin and then end. If ever pumped up too high, that could be crucial. The average or normal blood pressure is 120/80. If your blood pressure exceeds 140/100, then you have high blood pressure. If your blood pressure sustains at a low 100/60, then you have low blood pressure. Both high and low blood pressures can be very serious and could potentially lead to premature heart failure or other serious heart conditions. Also, a way to lower your blood pressure, if it is ever too high or too low, is to have proper medication or to reduce stressful situations. Now I'm going to demonstrate how to take blood pressure. Now if you have an older person, 10 or above, then you take the blood pressure the same way. The arm has to be resting, can't be up because then it could elevate. And their palm has to be faced up. You're going to put the blood pressure cuff up right above the elbow. You're going to follow the thumb line all the way up to right here in the crease of the elbow. And you're going to feel for the pulse. Once you feel it, then you know where to place your stethoscope. But you don't want to feel with your thumb because your thumb has a pulse itself. So you put your stethoscope in and you lightly tap it to make sure it's working. You place it right here. Then you pump the blood pressure cuff up, and once you begin to release it, then you're going to hear the pulse start, and that's your first number. And once you hear it end, then that's your last number. Thank you. Come here, Ty. Now, on a toddler, you do the same ways, but their numbers could be different, and their blood pressure cuff sizes are smaller. But their palm also has to be up and resting. You follow the thumb line right here to feel for the pulse. But also, if he was ever injured or in intensive care and they couldn't, say, get the blood pressure through his arm, they could also go down through his leg. They'd put the cuff right here, and they would find the pulse right back here. And you would just feel it with the tip of your fingers, just as you would in the crease of your elbow. Thank you. Matthew? Now, for somebody, say, a little bit older than a toddler, between toddler, preteen, or adult, theirs would also be the same way. You just have their arm, it has to be resting. You don't want it all bent, but just nice and resting. You follow the thumb line up the same exact way, but their numbers just may be different. Thank you. There are many purposes as to why you take blood pressure. Your blood pressure is important to take for health reasons, such as to know if it is ever high or low, which could damage your heart and lead to a heart attack, so it needs to be addressed. Having your blood pressure checked regularly, either by yourself or by a physician, can drastically reduce the chance of heart failure or other heart conditions. In conclusion, nursing is very difficult and precise. Anyone can become a nurse if you put your mind to it. Anyone can learn the task of taking blood pressure, you just have to try. It's very important to take your blood pressure very often and learn to do it very properly. Thank you.